with no contour of the jawline, no gonion. It's like a J. Now we do like an L. You see, with 2 cc of double XL, and I love this product because it's really the strongest one and with the highest G prime, and you can sculpt, not volumize. Forget the term volumizing and volume. We're talking about sculpting, contouring, and projection. And this is really a contouring of the jawline, and you see with the 3D camera on a black and white picture. So this is a new concept I bring today, the non-surgical jawline. I call it the L lift. Why L lift? Because you want to recreate the angle, and that creates an L. And then if it's not enough, we can do a little bit of horizontal branch of the mandible. And if it's not enough, we can also inject the chin. So this is the 3 parts: gonion, horizontal branch of the mandible, and chin. And we start from lower to up. Normally I do the from up to down. Let's change a little bit. So the same picture as Lucas. By the way, congratulations for your great presentation and concept. Angelina Jolie has a perfect jawline and the perfect chin projection. So we can try on regular patients to project and sculpt the gonion first, and the vertical branch, and also the horizontal branch. And for that, I love the double XL. You can also use XL, but for me, I think it's better to do the gonion with this XL and XL for the horizontal branch. And this is the patient on 3D. You see the 3/4 view, sorry. No chin, no angle, and a weird jawline. And then with 2 cc of double XL, you see that pyramid, that kind of triangle I recreated from the gonion, the horizontal branch, and the vertical branch of the mandible. And she's also had 1 cc on the chin of double XL. So how to do it safely? We inject at the tip of the angle of the bone, right here. So there is no masseter here if you stay behind. And then this is a deep injection on the bone, and then you go more superficial under the skin to avoid the parotid gland laterally and lower, and more superficial than the masseter. In the past, I was injecting in the masseter. The problem, if you inject in the masseter, then when you chew and you bite, the product goes away quickly. And this is the way to do it. You wear gloves, you use the antiseptic, and then you inject between your 2 fingers. And this is the immediate result with 1 cc. And you see the light and shadow, there is only a white, the skin, there is no limitation. And now you have a limitation and an angle. That was one of my first case 10 years ago. So the technique, you can see every single video I show you here are available on the Vivacy e-learn platform. So I just give you some short part. So you have to fill the bone, and when you fill the bone, then you start to inject on contact with the bone. You create a bolus or a pyramid. Then when you get this pyramid projection, you can go a little bit higher under the skin, not deep on because otherwise you are on the parotid. And then you can start to do a little bit of your horizontal branch. And you see the projection laterally, but also medially. I just want to show you something which is interesting, the indentation that you need now to do from the gonion there. So I prefer to use the needle because I feel where I am and I want to inject really deep. With the mandible, with the cannula, it's not so easy. And then, of course, I use the cannula because I want to spread the product all along the mandible, 5 or 7 centimeter long cannula, 25 goes 27, doesn't matter. And I like to be on this fat pad and the superficial fat under the skin, and then you break the retaining ligaments thanks to this cannula. And the cannula is great not only to inject, but also to do the subcision with this up and down movement to break the retaining ligaments. And you see, you can add a little bit more if you want, but then you have this horizontal branch of the mandible well defined. So if the chin is not that one, you can project the chin forward. And again, I like the double XL, silage double XL. And this is the technique, also the video available on the Hillel platform. So you look at the midline in between the teeth, then you go like 0.5 centimeter from the pogonion and perpendicular to project forward the chin. That's number one, to project the chin forward. And then a little bit lateral, otherwise, of course, you have an indentation. And then you can also inject a little bit lower than the chin to elongate on the profile the chin. So finally, what you create, you don't create a bolus, you create a pyramid. And if you look at the bone of the mandible, you see here, this is like a pyramid, okay? Why it is safe? Because you are in an avascular zone. This is the gel colored with methylene blue. You inject down to the bone. Here is the mentalis muscle. And all the vessels, they come from lateral. Forget this submental artery. They are never on the bone. There is not a hole, nothing. If you inject under the chin, of course, it's dangerous. If you inject lateral, it's dangerous. But down to the bone, if you want to aspirate, you can. Then this is a safe injection and very simple. And you don't need absolutely a long tool like a cannula to do this bolus or this pyramid. A needle is enough or a short cannula. So have a look at the result with 2 cc of double XL. You see the projection of this chin. And to be honest, and this is the transition, he had also an injection on the bridge of the nose. So that was the L lift for the jawline.